Hey guys, it's Mrs. Milan again. Here we go, try 2. This is chapter 1, lesson 2, and we have 4 objectives again today. So again, these are the important parts. These are the things you should take notes on. These really need to pay attention to. The first objective is to describe the purpose of OBRA, which stands for the Omnibus Reconciliation Act, and OSHA, which stands for the Occupational Safety and Health Association. Identify types of insurance is objective number 2. Number 3 is to differentiate or know the difference between Medicare and Medicaid. And last but not least, you need to know what an MDS is and what it's used for, if you will. So let's look at what the government does for us for healthcare, or what they're responsible for. The government is in charge of making regulations. They are responsible for setting the requirements as far as how much training people need in order to say if somebody's competent. So for instance, in order to get a bachelor's of nursing, that you have to have 4 years of college, and that you're considered competent if you pass the state boards. Like, they're responsible for setting those types of rules and laws and that kind of thing. The government also has agencies that come into the facilities and make sure that they're clean and that they are providing quality care, things like that. So the Department of Health will come in and do inspections and things like that to make sure that people are receiving the care that there should be, and that the nurses and the doctors and all the other healthcare workers are providing care in the way that they should, and so that everybody can have access to that good quality healthcare. So there was this regulation called the Omnibus Budget Reconciliation Act, or OBRA, and it will become very important next year if you come back for the nursing class. It was a law that basically was put into place to protect residents of long-term care facilities, because a long time ago, people would just put older people in nursing homes, and they would kind of they were mistreated, they were not taken care of, they were maybe even kind of neglected, if you will. And so because of that, the government had to step in and make some regulations in order to protect the people that were going to be there, because they aren't able to care for themselves, they aren't able to stand up for themselves. So there are now regulations in place, so they were put in place to protect the residents. In addition to that, OBRA also establishes how much training and things that are needed for nursing assistants, and what the healthcare facilities need to provide the nursing assistants as far as education. Basically, they're looking out for the safety of the residents of long-term care facilities. On the other hand, there is OSHA, which stands for the Occupational Safety and Health Administration, or OSHA. That is a government regulation that is there to protect us as healthcare employees. Well, really, they are there for any type of employee. They set standards as far as what training that the facilities must provide for us. So for instance, when we start at a hospital, you have to have training on infection control and certain kinds of infections, so that you know what to do to protect yourself, things like that. So those are the government regulations that you need to know about. We're going to move on now and talk about insurance. So with insurance, it can be very confusing. It can be overwhelming at times, and insurance is one of those things that is constantly changing. It has changed since I've become a nurse, and it's probably really changed since my mother became a nurse. So it's one of those things that is just continuing as society changes and to change. But some things that you need to know about is something called group insurance. This is when an employer offers a rate for a group of people. So in other words, the people that work for them. So as an employer, the school would offer health insurance to its employees at a group rate, or the hospital would offer its employees health insurance at a group rate. That's what we mean when we say group insurance. Another term that you're going to hear when you talk about insurance is something called a pre-approval or a pre-certification process. What this is that a healthcare provider has to provide some kind of documentation or certification that a patient needs a procedure. So for instance, say I injured my foot or my arm and it isn't getting better and I need an MRI. The insurance may require that I do physical therapy or that I have an x-ray and before I have an MRI, that kind of thing. So the insurance companies are part of that process. I guess it's their way maybe to make sure that procedures aren't ordered that are not needed. There's three kind of categories of insurance that your book talks about. They talk about managed care, which is when you arrange contacts with different healthcare providers. So they have like a list of providers, and those are the ones that you have to pick through. There's preferred provider organization, or PPO. This is when a contract is made between the insurance company and the healthcare provider, so a doctor or a dentist or what have you, and that they will accept a certain payment. So maybe the doctor charges $65 for an office visit, but the insurance company has already said, I'm going to give you $60. And that healthcare provider has said, okay, I'll take that. So even though maybe another type of insurance, they would have to pay $65, or if the person didn't have insurance and had to pay it out of their pocket, they would have to pay $65. But because of this contract that they made with the insurance company for that prepayment or that acceptable payment, that is what is going to be paid. There's another kind that's called Health Maintenance Organization, or an HMO. This is when healthcare providers are contracted with the insurance, and so you have to pick from this list of doctors, and they arrange services at a prepaid fee. So it's kind of paid up front, and that's kind of what the doctor gets, and everything that happens is this is the fee, it is what it is kind of thing. One kind of insurance that you will hear a lot about is Medicare. This is one that all people over the age of 65 are eligible for, as well as people who are on disability. So if somebody was, say, in a car accident and disabled at the age of 25, they are still eligible for Medicare even though they're not 65. Medicare is responsible for developing the system called a DRG, which stands for Diagnosis Related Group. So based on their diagnosis, or in other words, what's wrong with a person, this is how much money they're going to get. So if somebody comes into the hospital for their knee to be replaced, they get X amount of dollars, and that's all the hospital is going to get. It doesn't matter if the person's there 2 days or a week. They're still only going to get this amount of money. Now, the development of these DRGs have led to patients being discharged quicker than ever before. It has led to people going home sicker than they have ever before, because the hospitals are only, and doctors are only going to get a certain amount of payment whether that person's there 2 days or a week. So they try to get them to stay as least amount as possible and get them out the door, so to speak, in order to get there, because it doesn't matter if they're there longer or not, they're only going to get a certain amount of money. But that's Medicare, those are DRGs, so based on the diagnosis. Now there's another type of insurance called Medicaid. This is for people who are in low income. So it is operated federally, but each individual state kind of runs it. And only certain facilities will accept Medicaid. They have to be approved by the state agency in order to accept it, and that kind of thing. So Medicare is for older and disabled people, and Medicaid is for low-income families. Make sure you don't interchange them in your mind, kind of thing. And the last objective talked about an MDS, and which stands for a minimum data set. And if you look in your book, there is a little chart that kind of gives you an idea of what that would look like. This is a form that somebody in a nursing home fills out for each individual resident, and it tells and describes in detail what type of care that person needs. In some facilities, there is a nurse or a person that is their whole job, that they do nothing but fill out these forms on all their residents. But basically, it's for Medicare. That way, they can come in and they can see exactly what kind of care they need. Are they able to feed themselves? Can they dress themselves? And so that person is constantly having to update that on the patients and making sure that that is up to date. But that's a minimum data set, or an MDS. All right, so if you guys have any questions, shoot me an email. You guys have my email by now, and I will see you later. Bye.